Hello, everyone, and welcome back to the Journey Out podcast, where we were designed to be the helping hand for everyday people who are on their Exodus journey. I am one of your hosts, Bry.
And I'm Antoine.
And we are continuing with Health Literacy Month, and we wanted to discuss with you all today about finding the right primary care provider for you.
What is home care?
How do I navigate healthcare?
What do I do when I feel down and depressed?
I'm stressed.
Am I enough?
What can I do?
What is this going to cost?
So what is a primary care provider? So a primary care provider is a doctor or licensed medical professional who manages a patient's health care, usually as their first point of contact for medical care. So choosing the right primary care, and we're going to break that down like as a PCP is what you call that, is crucial for long-term health. Your PCP plays a role in preventative care, treating common health issues, and coordinating with specialized care. So talk to me a little bit about what preventative care looks like from PCPs.
So preventative care looks like routine screening such as regular checkups, mammograms, and prostate exams, routine shots, right? Health education such as diet, exercise, and smoking counseling, chronic disease management, mental health screening, and sending out specialist referrals.
Awesome. Okay, so when you talked a little bit about like chronic conditions, so one of the big things that PCPs do is they manage common medical conditions. So PCPs can diagnose and treat health problems with things like flu, colds, infections, and chronic conditions like diabetes and high blood pressure. And what that role looks like is prescribing medications. That's what preventative does. Prescribing medications, developing treatment plans for those chronic conditions, or even addressing acute issues like UTIs and things like that. You also talked about referring out to specialists. So when a condition requires specialized care, typically your provider is going to send you to a doctor that specializes in that care. So if
be an ear, nose, throat specialist.
Exactly. Or if you're having heart issues, you're going to send you to a cardiologist. Or thyroid issues, they're going to send you to an endocrinologist. So it really just depends on what you need. And we'll talk a little bit more about that, next. But talk to me a little bit about continuity of care and kind of how the PCP plays a role in that.
So continuity of care, ongoing trust and communication resulting in personalized care with your PCP. That's long-term health management.
Right.
That's also support during transitions such as hospitalizations and recovery. Patient advocacy such as helping patients navigate the healthcare system.
Right.
And that can be like you said, specialists, referring them over to certain specialists to do certain things. Right.
And I think it's important for everyone to know that a primary care provider is not just there to provide the care at your doctor's visit. They're also there to do exactly like you said, advocate for you. They're there to navigate you to the people who needs that care. But also, it's super important that you understand that they're fighting for you in your care.
Yes.
So that's super important to know. So let's jump into a little bit about the types of primary care physicians that are out there. So we have family practitioners, and so that's broad care for patients of all ages. We also have pediatricians, and those are specialists for newborns, children, and adolescents. We also have geriatricians who focus on older adults with aging health-related issues. What else do we have? You have
internist specialists that's in adult care. OBGYNs who often serve as PCPs to women, especially during the childbearing years. Nurse practitioners and physician assistants who offer similar services as a PCP and can be excellent choices for primary care.
Right. With these physicians, it's super important to know where you want to go, who you need to go to. If you're an adult, 65 years old, you're not going to go to a pediatrician, right? You're going to go to a geriatrician to make sure that you're getting the care that you need. Again, personal care, specialized care specifically for you. And then from there, they can make those, referrals out to whomever else you need to see. So now let's talk about factors you want to consider when choosing a PCP. So this is super important. What would you say would be one or two or three big factors for you when choosing a PCP?
One is location.
Yeah,
location
absolutely.
is a big factor. The location, consider how close it is to your job and to your home. If you need to make an emergency appointment with a PCP. Also in making those emergency appointments if they have after hours. whether a nurse practitioner or that physician assistant is available to see you after work if you need to. Also, is the staff friendly?
Right.
Is the staff friendly, and is it easy to communicate with them, right? Is it easy to get in touch with them through email or through the portals that they have set up for? So those are some things that I think I'll be really concerned with when
choosing a PC. Now, I think one of the big things that you said there is is it staff friendly? The character is important when you're going in and trying to find the right PCP, because for me, I want you to be friendly, I want you to be warm and inviting, but also I'm a very direct person. You let me know what's going on. You don't beat around the bush. I'd rather know than not know. Let me know, and I can make those decisions that I need to make.
And being comfortable with your PCP is paramount, because you're really opening up, right?
Right.
This person has a lot of information about you, and you have to share how you feel with this person, and you have to feel comfortable in doing that. So communication
is super key.
Is key.
Yeah. And so I think some of the things that I would also say with that would be insurance and networks, because a lot of times what happens is your insurance company has a list of providers that they are contracted with, that they work with. So one, speaking with your insurance company and figuring out what providers are on that list, okay, and then going from there and narrowing down your choices and your options, one's closest to you and things like that. I think also, like I was saying earlier, I'm a very direct person. I want to know what's going on with me, so that way we can really talk about my treatment. So I want to talk about approach to treatment. Right. What are you conservative? Are you a conservative doctor? Are you a more aggressive doctor? How do you interact with other specialists?
And what's the short-term and long-term goal to dealing with this?
Exactly. And kind of like what you was also saying, availability. What are your office hours? Can I contact you when I have questions about something that we discussed in the doctor's office that I thought about later on after that appointment?
What if something just pop up, right?
Exactly.
That I wasn't aware of, right? Or that's concerning to me about my health. Can I get in contact with you or
absolutely.
your staff?
Yeah, and that's important. That's critical to be able to have that open communication between the both of you. We talked about choosing a PCP, and we talked about going through the insurance route, because that's really going to determine which doctor you can go to, checking that network. But how do you also research the doctor or get even different referrals from other doctors? And I would say the first one I would say was using online resources. There are state medical associations. There's your insurance, of course, directories, advocacy groups for specific conditions where they say, hey, Dr. So-and-so helped me and my mom during this cancer. And he was so pivotal in the growth and her getting off the chemo meds or whatever that looked like. Going there and asking those questions too. What would you say?
In that aspect of what you're saying, recommendation. Ask for recommendations, right? You can ask recommendations from your friends, family, or health professionals like pharmacists or dentists or whoever you trust.
Right.
Those people that you trust have had an experience with a PCP or someone that they say, hey, they feel comfortable. Hey, I know you. Right. You family, you friend. I know what you think, how you think, or what you're looking for. This person to be a best for you.
Yeah. I definitely agree with that. And I think once you narrow it down, don't be afraid to set up an interview with your doctor. Right. Don't be afraid to say, hey, just like
a consultation.
Yeah. And I would literally treat it like, hey, I'm about to hire you to be a part of my life, to help me make major decisions in my life. Right. I need to check the references. I need to run the background checks. I need to ask all the questions, because when you interview them, you get a sense of like their communication style, their approach to care, how comfortable you may feel or not feel with them. Like you get to experience them first before you can
actually
dive into it.
And that's what we talked about a little bit before. Open communication.
Open communication.
Right, being trustworthy. And letting this person know about you, right? That some wives or husbands don't know about their spouses, right? But you telling this to your doctor, right? Exactly. And confiding in him. So you have to be comfortable. And go ahead.
Yeah, and so if we take the interview process, like if we're, hey, I'm hiring you to be a part of my medical team. If we take the interview process, during that consultation phase, there are some questions you want to ask, like, how do you prefer to communicate with your patients? Is it email? Is it phone? Is it the patient portal? Or what is your approach to preventative care? And how do you manage chronic conditions. I have such and such going on. What is your thoughts about this medication or this treatment plan or things like that? Additionally, I would also ask, how do you involve patients in the decisions about their care? To me, that's
critical.
Oh, that is so important, because a doctor can say, okay, we're going to give you this medication, but what if I want to take a more alternative route? Are you comfortable discussing that with me?
Right. That's why it's, again, communication, being open with your PCP, and you learn more about him, because, hey, if he say, hey, this is what we want to use this medication, and you, like you said, an alternative route.
Right.
Or your belief system might say, hey, no, they don't play a part in what I believe.
Huge.
So it's
that's huge.
That consultation, that interview, as you say, it's a lot of information that needs to be laid on the table to help you make the best decision for your PCP.
Right, and then after the interview, right, or the consult, you ask the questions that you need to ask. Okay, now you have to reflect on the answers that you got. So, did the provider take time to really, truly answer your questions? Did you feel listened to and respected during that consult? Or was the office environment clean? Was the staff nice? What was that first impression?
Was it welcoming when I came in there, right? So first impression, you only get one time to make a first impression.
You do. And so it goes for your medical staff, your medical team that you're wanting to come into your life and assist you with these big decisions. Right. We talked about how to choose a PCP. We also talked about some questions that you want to ask if you're able to interview and consult with them beforehand. Right. What would you say would be key for preparing for your first appointment?
When preparing for your first appointment, you want to bring a list of your medications.
Oh, yeah.
Right?
Oh, yeah.
And you want to also bring any medical records that you have previously.
Right.
Right? That can help give the doctor an understanding. With medications, bring your bottle of medication, right? So the doctor can see everything, right? That's being that you have been taking, right? Like we said, previous health records, of course, and any questions that you may have for the doctor, you can also have those written down and ready to go.
Ready to go, prepared. Yes, absolutely, I agree with that. I think also too, one good one would be, like you said, write down a list of questions that you may have, but also write down some goals, some health goals that you may have. Discuss your health goals with your doctor. So be open about them, whether it's lifestyle preferences or expectations from them. Like, hey, so these are some of the goals. If you're pre-diabetic, right, and you're taking a medication forward right now just to try to maintain it. So, hey, doc, I want to get off this medication. That is a goal for me. So help me make a lifestyle change. Help me kind of come up with a lifestyle change that can best help me meet that goal.
And in that, in coming to the doctor's appointment and being prepared, you got to be prepared for what the doctor may say, right? Because not knowing too much about the medication you're taking, your diagnosis, or what you're dealing with, that doctor probably say, hey, well, no, this is not a short-term or a long-term goal.
Right.
The doctor probably see it different. So you have to be open-minded to what that doctor will say once you sit down and have that conversation.
Agreed. And so that was one example. But again, like weight loss. Weight loss is a huge goal for everybody. Weight management, right? So again, express that to them. Hey, I want to lose some weight. I want to regulate my blood pressure. I want to do all these things. How can I do those things? We already know where that starts, right?
When you go when you go to the doctor and you ask them about losing weight, please be prepared to do some exercises, right?
And maybe change your diet.
Change your diet, because those two things are going to play a big part.
Right.
And I know, so.
Yeah. Well, and it's a work in progress.
Yes.
And that's also what is super important, to make sure that even as you're, going through your health goals with your provider, they should also make you feel comfortable in knowing that, hey, this is a work in progress. There are steps that we have to take. Right. But let's break this down in increments that is doable for you. So that way, when we come the next time, we see some improvement, and it keeps you on track to succeed and reach that goal.
Now, don't get mad at the doctor if you're not getting no improvement because you're not doing your part. Message.
Wait, I was registering what you were saying, but no, that is
true.
That is so true.
I mean, that goes with expectations on first visits and stuff like that. Listen, the doctor is a doctor for a reason, right? he's not perfect by any means, but he knows what he's talking about. And again, when you go and talk to a PCP and you're looking to find a new PCP, being prepared is crucial, and also being prepared for the answer you receive back. What he may say back to you is crucial as well. Maybe for some people, I know we can't probably get off the subject, but for some people, it's always not what you want to hear, right? But it's sometimes what you need to hear so you can make the best decision for short-term and long-term goals. Right.
And one of the things when I started, setting your goals, not just for health or lifestyle preferences, but also your expectations.
Right.
Like you said, how do you want your check-ins or your follow-ups to go? But you also got to understand, if you have expectations, the doctor does as well.
Yes.
And it's important that you guys can collaborate and kind of compromise and work together to make sure that you're getting the end result that you want.
Yes.
So I think it's just important overall that you prepare yourself by doing the research, doing what needs to be done, and then once you come into your first visit, really honing in on, hey, this is what I'm wanting, this is what I'm dealing with now. Let's have a plan to make me better overall health-wise.
I agree.
So we discussed a lot in this episode.
Yes.
We discussed a lot, but here are some key takeaways that I want to make sure that you remember when you log off today. Number 1, research your options. Ask family and friends, check your insurance network, and consider location, specialties, and patient reviews when selecting your PCP. The second thing you want to do is consider that provider's approach to treatment, their availability, continuity of care, and how well you can trust them.
Right.
And the third thing you want to make sure that you take away from this episode is, when preparing for your first visit, gather all your medical history, prepare your questions, set some health goals, lifestyle preferences, and expectations of your providers and visits. But also, one thing that I really want y'all to remember is to bring a medication list, or lump all your medications into a bag and bring them with you.
Yes.
So that way they have a clear understanding of what you're going through and what you're taking. So we want you to evaluate your current PCP or take steps to find the right one if you don't have one, utilizing these tips and tricks to make sure you find a PCP right for you. To gather all of what we talked about today, please click the link in our bio, taking you over to our podcast website to be able to download everything discussed today, transcribed just for you under the transcript tab. If you've enjoyed what you've heard today and would like to hear more, please subscribe and follow us on YouTube at The Journey Out, and on our podcast website. You can support The Journey Out podcast, helping us to continue to provide these episodes every week, as well as follow us on all podcast platforms. And with that, that's a wrap on today's episode of The Journey Out. We pray that the things discussed today have been a helping hand for you and the ones you hold close, positively bringing you out of one season to the next, starting your Exodus journey.
And we hope you gain knowledge and learn some resources so you can be a resource to your family and to your community.
Yes, sir.
We're out.
Bye-bye.